Question 1. Stakeholder feedback indicates that some limited licensed radiology technologists are encountering situations where patients, due to discomfort or personal preference, request to alter standard positioning for digestive system imaging, potentially compromising the diagnostic quality. Patient undergoing an abdominal X-ray for suspected bowel obstruction is expressing significant discomfort with the standard supine position and requests to be imaged in a semi-recumbent position. The technologist understands that the supine position is generally preferred for visualizing abdominal contents and identifying air fluid levels indicative of obstruction due to gravity's effect on fluid and gas distribution within the digestive tract. What is the most appropriate course of action for the limited licensed radiology technologist in this scenario? Option A. Immediately perform the X-ray in the semi-recumbent position as requested by the patient to ensure patient comfort and avoid potential refusal of the exam. Option B. Insist on the standard supine positioning, informing the patient that their comfort cannot be prioritized over the diagnostic requirements of the examination. Option C. Explain to the patient the anatomical and physiological reasons why the supine position is optimal for detecting air fluid levels in the digestive system, discuss potential diagnostic limitations of the requested position, and explore if any minor adjustments to the supine position can improve comfort while maintaining diagnostic integrity. Option D. Proceed with the X-ray in the semi-recumbent position, and then perform an additional X-ray in the supine position to ensure adequate visualization, without consulting the referring physician. Correct answer is C. Explain to the patient the anatomical and physiological reasons why the supine position is optimal for detecting air fluid levels in the digestive system, discuss potential diagnostic limitations of the requested position, and explore if any minor adjustments to the supine position can improve comfort while maintaining diagnostic integrity. Explanation. This scenario presents a professional challenge due to the conflict between a patient's expressed preference and the technologist's understanding of optimal diagnostic imaging based on anatomical knowledge. The technologist must balance patient autonomy with the professional responsibility to provide accurate and effective diagnostic services, adhering to established protocols and ethical guidelines. Careful judgment is required to navigate this situation without compromising patient care or professional integrity. The correct approach represents best professional practice because it prioritizes patient well-being and diagnostic accuracy while respecting patient autonomy within the bounds of professional competence. By explaining the anatomical reasons for the recommended positioning and offering alternatives that still achieve diagnostic goals, the technologist demonstrates a commitment to patient education and collaborative decision-making. This aligns with the ethical principle of beneficence, acting in the patient's best interest, and respect for autonomy, as long as the patient's decision does not fundamentally compromise the diagnostic integrity of the exam or pose a safety risk. The technologist's actions are guided by their understanding of digestive system anatomy and how it influences image quality and diagnostic yield, ensuring the exam is performed to the highest possible standard within the patient's constraints. An incorrect approach that involves immediately acceding to the patient's request without explanation or attempting to persuade them otherwise fails to uphold the technologist's professional responsibility. This could lead to suboptimal imaging, potentially requiring repeat scans, or resulting in mispathology, which violates the principle of non-maleficence, avoiding harm and beneficence. It also neglects the technologist's duty to educate the patient about the procedure and its requirements. Another incorrect approach, such as insisting on the original positioning without considering any patient comfort or offering reasonable compromises, could be perceived as disrespectful of patient autonomy and potentially coercive. While the technologist's anatomical knowledge is paramount, a rigid adherence without empathy or exploration of alternatives can damage the patient-technologist relationship and lead to patient dissatisfaction or refusal of the exam. This approach may also overlook potential underlying reasons for the patient's discomfort that could be addressed. The professional decision-making process for similar situations involves a systematic approach. 1. Assess the patient's request and understand the underlying reasons. 2. Evaluate the request against anatomical knowledge and its impact on diagnostic quality and patient safety. 3. Communicate clearly and empathetically with the patient explaining the anatomical rationale for the recommended positioning and the potential consequences of deviating from it. 4. Explore alternative positioning options that might accommodate the patient's needs while still achieving diagnostic objectives. 5. If a compromise is not possible and the patient's request would significantly compromise the diagnostic integrity or safety of the exam, consult with the supervising physician or radiologist. 6. Document the patient's request, the discussion, and the final decision. Question 2. The monitoring system demonstrates that a patient scheduled for a lumbar spine radiograph is exhibiting significant signs of distress and verbalizing extreme discomfort with the requested supine positioning, stating they cannot tolerate lying flat on their back for the duration of the procedure. As a limited licensed radiology technologist, what is the most appropriate course of action? Option A. Adjust the patient's position significantly to a more comfortable lateral recumbent position without consulting any supervisor, prioritizing patient comfort over image quality. Option B. Proceed with the standard supine positioning as per protocol, instructing the patient to try and tolerate the discomfort for the short duration of the exam. Option C. Immediately terminate the examination and inform the patient that the procedure cannot be performed due to their inability to cooperate with the positioning requirements. Option D. Gently attempt to find a slightly modified position that is more tolerable for the patient while still allowing for adequate visualization of the lumbar spine. And if this is not possible, consult with the supervising radiologist for alternative positioning or imaging recommendations. The correct answer is D. Gently attempt to find a slightly modified position that is more tolerable for the patient while still allowing for adequate visualization of the lumbar spine. And if this is not possible, consult with the supervising radiologist for alternative positioning or imaging recommendations. Explanation. Scenario analysis. This scenario presents an ethical dilemma where a technologist must balance patient comfort and dignity with the need for accurate diagnostic imaging. The patients expressed discomfort and potential for anxiety due to the positioning requirement for the lumbar spine radiograph create a conflict. The technologist's responsibility extends beyond simply acquiring an image. It includes ensuring the patient's well-being and respecting their autonomy within the bounds of professional practice and regulatory requirements. The challenge lies in finding a solution that minimizes patient distress while still achieving diagnostic quality images, adhering to established protocols and ethical guidelines for limited licensed radiology technologists, CLLRT, in the specified jurisdiction. Correct approach analysis. The correct approach prioritizes patient comfort and dignity while still striving for diagnostic quality. This involves attempting to find a compromised position that is tolerable for the patient and can still yield acceptable diagnostic information, or exploring alternative imaging techniques if the compromise is not feasible. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, as well as the professional responsibility to provide care with respect and compassion. It also implicitly acknowledges the CLLRT scope of practice, which may allow for some flexibility in positioning to accommodate patient needs, provided diagnostic quality is not unduly compromised, and the procedure remains within the CLLRT authorized scope. The CLLRT should communicate with the patient, explain the necessity of the position, and explore gentle adjustments. If significant compromise is unavoidable, consultation with a supervising radiologist or physician for alternative imaging or positioning guidance would be the next appropriate step, ensuring patient safety and diagnostic efficacy are maintained. Incorrect approaches analysis. One incorrect approach involves proceeding with the positioning as initially instructed without further attempt to alleviate the patient's discomfort. This fails to uphold the ethical principle of patient dignity and can lead to patient distress, potentially impacting the patient's willingness to cooperate with future medical procedures. It also neglects the technologist's duty of care to minimize patient suffering. Another incorrect approach is to abandon the examination entirely due to the patient's discomfort without exploring any alternatives or seeking further guidance. This could be considered a failure to provide necessary diagnostic services and may violate professional standards of care if the examination is clinically indicated and could have been performed with reasonable accommodation. A third incorrect approach is to significantly alter the positioning to the point where the diagnostic quality of the image is compromised, without consultation or justification. This directly violates the core responsibility of a radiologic technologist to produce diagnostic quality images. While patient comfort is important, it cannot supersede the fundamental requirement for a medically useful image, especially when the CLLRT scope of practice is defined by specific diagnostic capabilities. Professional reasoning. When faced with a patient experiencing discomfort during positioning, a limited licensed radiology technologist should follow a structured decision-making process. First, acknowledge and validate the patient's discomfort. Second, clearly explain the clinical necessity of the required position and the potential diagnostic implications of not achieving it. Third, explore gentle, minor adjustments to the position that might improve comfort without compromising image quality. Fourth, if significant discomfort persists and adjustments are insufficient, consult with a supervising radiologist or physician to discuss alternative positioning strategies, imaging modalities, or to obtain specific authorization for deviation from standard protocol. This process ensures that patient well-being is considered alongside the imperative to obtain diagnostically sound images, adhering to regulatory and ethical obligations. Question 3. The efficiency study reveals that a limited licensed radiology technologist, CLLRT, is tasked with performing chest X-rays. During image acquisition, the technologist observes what appears to be an unusual density in the lung field and a flattened appearance of the diaphragm. Considering the CLLRT scope of practice and regulatory framework, which of the following actions best represents professional conduct? Option A. Informing the patient directly that they likely have a serious lung condition based on the observed density. Option B. Omitting the observation of the flattened diaphragm from the report, as it was not the primary focus of the examination. Option C. Suggesting to the referring physician that the flattened diaphragm indicates the patient has severe emphysema. Option D. Documenting the observed density and the flattened diaphragm as objective findings in the imaging report, noting their location and characteristics without interpretation. The correct answer is D. Documenting the observed density and the flattened diaphragm as objective findings in the imaging report, noting their location and characteristics without interpretation. Explanation. Scenario analysis. This scenario presents a challenge for a limited licensed radiology technologist, CLLRT, by requiring them to interpret findings related to respiratory system anatomy in the context of a diagnostic imaging study. The CLLRT role is to acquire images according to established protocols and physician orders, not to provide definitive diagnoses. Misinterpreting or overstepping their scope of practice by making diagnostic pronouncements can lead to patient harm, misdiagnosis, and legal repercussions. The professional challenge lies in recognizing the limits of their licensure and expertise while still contributing valuable information to the patient's care team. Correct approach analysis. The correct approach involves accurately documenting observations related to the visible anatomy of the respiratory system as depicted in the images, without offering a diagnosis or suggesting a specific pathology. This aligns with the scope of practice for an CLLRT, which emphasizes image acquisition and technical proficiency. By reporting objective findings such as the presence or absence of opacities, the position of the diaphragm, or the clarity of lung fields, the CLLRT provides essential data for the interpreting physician. This adheres to regulatory guidelines that define the CLLRT responsibilities and emphasizes their role as a technical provider of diagnostic information, not a diagnostician. This approach ensures patient safety by preventing premature or incorrect conclusions and upholds professional integrity by respecting the roles of other healthcare professionals. Incorrect approach is analysis. One incorrect approach involves suggesting a specific diagnosis, such as pneumonia or pleural effusion, based on the imaging findings. This is a direct violation of the CLLRT scope of practice. Regulatory frameworks for CLLRT strictly prohibit independent diagnosis, as this is the purview of licensed physicians. Such an action constitutes professional misconduct and could lead to disciplinary action, including license revocation. It also poses a significant risk to patient care by potentially misleading the patient and other healthcare providers. Another incorrect approach is to ignore or fail to report significant anatomical variations or abnormalities observed in the respiratory system, even if they are not the primary focus of the examination. While CLLRT are not expected to be diagnosticians, they are expected to recognize and report findings that are clearly outside normal anatomical parameters and could indicate a serious condition. Failing to report such findings, even if not explicitly asked to look for them, can be considered negligence and a breach of professional duty to patient safety. Regulatory guidelines often imply a responsibility to report significant incidental findings that could impact patient care. A third incorrect approach is to provide a subjective interpretation of the image quality in relation to the patient's breathing effort, implying that the patient's respiratory status is the cause of any perceived image artifact. While CLLRT are trained to assess image quality, attributing specific anatomical or physiological findings to patient effort without objective evidence or physician guidance falls outside their defined responsibilities. This can lead to miscommunication and potentially incorrect assumptions about the patient's condition. Professional reasoning. When faced with imaging findings related to the respiratory system, an CLLRT should follow a structured decision-making process. 1. Review the physician's order to understand the primary reason for the examination. 2. Acquire images according to established protocols, ensuring optimal technical quality. 3. Critically evaluate the images for anatomical accuracy and the presence of any gross abnormalities within the scope of their technical observation. 4. Document objective findings related to the visible anatomy of the respiratory system, using precise and descriptive language. 5. Report any significant deviations from normal anatomy or unexpected findings to the interpreting physician or supervisor, as per facility policy and regulatory requirements. 6. Refrain from making diagnostic interpretations or offering opinions on the patient's condition. 7. Continuously seek professional development to enhance their understanding of anatomy and potential imaging findings, while always respecting the boundaries of their licensure. Question 4. Quality control measures reveal that a routine chest X-ray demonstrates an unusual prominence of the azygos vein arch, appearing as a distinct rounded opacity in the right upper lung zone. The patient has no reported symptoms. As a limited licensed radiology technologist, CLLRT, what is the most appropriate immediate action? Option A. Document the finding accurately in the patient's report, noting its appearance and location, and ensure it is clearly visible for radiologist review. Option B. Assume the finding is a normal anatomical variant and proceed with the examination without further comment, as the patient is asymptomatic. Option C. Adjust the imaging technique to obscure the prominence, as it is not a primary area of interest for a standard chest X-ray. Option D. Immediately flag the finding as a potential mass and request a biopsy, as any unusual opacity requires further investigation. The correct answer is A. Document the finding accurately in the patient's report, noting its appearance and location, and ensure it is clearly visible for radiologist review. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the limited licensed radiology technologist, CLLRT, to interpret subtle anatomical variations that could impact diagnostic accuracy. The CLLRT must not only identify the anomaly, but also understand its potential implications for image acquisition and interpretation by the radiologist, ensuring patient safety and optimal diagnostic yield. This demands a strong foundational knowledge of human anatomy as it relates to radiological imaging, going beyond simple identification to functional and positional understanding within the context of the imaging modality. Correct approach analysis. The correct approach involves recognizing the anatomical variation, correlating it with the patient's clinical presentation and the specific imaging protocol, and documenting the finding accurately for the radiologist. This aligns with the CLLRT scope of practice, which includes acquiring diagnostic quality images and recognizing significant findings. The regulatory framework for CLLRT emphasizes the importance of accurate image acquisition and preliminary assessment to support the radiologist's final diagnosis. By identifying and reporting the anatomical variation, the CLLRT is fulfilling their responsibility to contribute to patient care and ensure the diagnostic integrity of the examination, adhering to professional standards of practice and the ethical obligation to patient well-being. Incorrect approaches analysis. Ignoring the anatomical variation is a significant regulatory and ethical failure. It directly compromises the diagnostic quality of the examination and could lead to misdiagnosis or delayed diagnosis by the radiologist, violating the CLLRT duty of care. Failing to document the finding or communicate it to the radiologist is also a breach of professional responsibility, as it deprives the interpreting physician of crucial information. Misinterpreting the variation as a pathology without proper justification or consultation is another failure, as it exceeds the CLLRT scope of practice and could lead to unnecessary patient anxiety or further inappropriate investigations. This demonstrates a lack of anatomical knowledge and a failure to adhere to established protocols for reporting and communication. Professional reasoning. Professionals should employ a systematic approach when encountering unexpected findings. This involves 1. Observation, carefully observing all anatomical structures within the field of view. 2. Identification, accurately identifying the observed structure and comparing it to normal anatomical variations. 3. Correlation, correlating the finding with the patient's clinical history and the specific imaging protocol being used. 4. Documentation and communication, clearly documenting the finding and communicating it to the supervising radiologist following established institutional protocols. This decision-making process ensures that all relevant information is considered, leading to accurate and safe patient care within the CLLRT-defined scope of practice. Question 5. Cost-benefit analysis shows that while advanced imaging techniques can offer detailed anatomical visualization, the primary role of the limited licensed radiology technologist, CLLRT, in diagnosis and treatment planning is to acquire images that are diagnostically sufficient for the clinical question while adhering to radiation safety principles. Considering this, which of the following approaches best reflects the CLLRT responsibility when faced with multiple imaging options for a patient's condition? Option A. Strictly adhere to the referring physician's initial imaging order without further evaluation, assuming it is always the most appropriate choice. Option B. Prioritize the imaging modality that is quickest to perform and most readily available in the department, regardless of its diagnostic yield for the specific clinical question. Option C. Choose the imaging modality that offers the highest level of image detail, even if that level of detail exceeds what is clinically necessary for the presented condition. Option D. Select the imaging modality that provides the most diagnostically relevant information for the specific clinical question with the lowest possible radiation dose. The correct answer is D. Select the imaging modality that provides the most diagnostically relevant information for the specific clinical question with the lowest possible radiation dose. Explanation. Scenario analysis. This scenario presents a professional challenge because the limited licensed radiology technologist, CLLRT, must balance the immediate need for diagnostic information with the potential for unnecessary radiation exposure and associated risks. The CLLRT role is to acquire high-quality images that are diagnostically useful, but this must be done responsibly, considering the patient's overall well-being and the principles of radiation protection. The challenge lies in determining the most appropriate imaging modality and protocol when multiple options exist, each with varying levels of diagnostic yield and radiation dose. This requires an understanding of the clinical question, the limitations of different imaging techniques, and the potential benefits versus risks for the specific patient. Correct approach analysis. The correct approach emphasizes selecting the imaging modality that provides the most diagnostically relevant information for the clinical question with the lowest possible radiation dose. This aligns directly with the CLLRT, as low as reasonably achievable principle, a cornerstone of radiation safety regulations in the U.S., which is implicitly part of the CLLRT scope of practice. By considering the clinical context and the diagnostic capabilities of each modality, the CLLRT ensures that the imaging performed is not only effective in aiding diagnosis and treatment planning, but also minimizes potential harm to the patient. This approach prioritizes patient safety and the ethical responsibility to avoid unnecessary radiation exposure, which is a key tenet of professional conduct for radiologic technologists. Incorrect approaches analysis. One incorrect approach involves prioritizing the modality that is quickest or most readily available without a thorough consideration of its diagnostic efficacy for the specific clinical question. This could lead to unnecessary radiation exposure if a less appropriate modality is used, potentially yielding insufficient information for accurate diagnosis and treatment planning. This fails to uphold the CLLRT principle and could result in repeat imaging or further, more invasive, diagnostic procedures. Another incorrect approach is to select the modality with the highest perceived image quality, regardless of whether that level of detail is clinically necessary for the presented problem. While image quality is important, exceeding the required diagnostic threshold can lead to unnecessarily high radiation doses. This disregards the risk-benefit assessment inherent in responsible imaging practice and may not be justifiable under radiation safety guidelines. A third incorrect approach is to defer entirely to the referring physician's initial request without engaging in critical thinking about the appropriateness of the chosen modality. While physician orders are crucial, the CLLRT has a professional responsibility to ensure the ordered examination is the most appropriate and safest option, and to communicate any concerns. Blindly following an order without considering the diagnostic yield and radiation implications for the specific patient can lead to suboptimal care and potential harm. Professional reasoning. Professionals in this field should employ a systematic decision-making process that begins with understanding the clinical question. This involves reviewing the patient's history and the reason for the examination. Next, they should evaluate the diagnostic capabilities of available imaging modalities in relation to the clinical question, considering factors such as sensitivity, specificity, and the type of information each modality provides. Concurrently, they must assess the radiation dose associated with each modality and consider patient-specific factors that might influence risk, e.g., age, pregnancy status. The decision should then be based on selecting the modality that offers the best diagnostic information for the clinical question while adhering to the ALARA principle. If there is any ambiguity or concern about the appropriateness of an ordered examination, the CLLRT should consult with a supervising radiologist or physician to ensure the most effective and safest imaging strategy is employed. Question 6. Stakeholder feedback indicates a recurring concern regarding the time taken to complete certain fluoroscopic procedures, with some staff suggesting that faster image acquisition settings might be beneficial for patient throughput. As a limited licensed radiology technologist, CLLRT, what is the most appropriate initial step to address this feedback while ensuring patient safety remains paramount? Option A. Advise the stakeholders that patient throughput is secondary to established imaging protocols and that no changes will be considered. Option B. Initiate a review of current fluoroscopic protocols, consulting relevant CLLRT guidelines and established patient safety standards to assess the feasibility and safety implications of adjusting image acquisition parameters. Option C. Rely on the personal experience of senior technologists to determine if faster image acquisition settings are safe and effective. Option D. Immediately implement faster image acquisition settings on the fluoroscopy equipment to address the feedback and improve patient throughput. The correct answer is B. Initiate a review of current fluoroscopic protocols, consulting relevant CLLRT guidelines and established patient safety standards to assess the feasibility and safety implications of adjusting image acquisition parameters. Explanation. This scenario presents a professional challenge because it requires balancing efficiency with patient safety, a core tenet of radiology practice. The feedback highlights a potential gap in the current safety protocols, necessitating a review and potential update. Careful judgment is required to ensure any changes implemented are both effective in addressing the identified concerns and compliant with established regulations. The correct approach represents best professional practice because it directly addresses the stakeholder feedback by initiating a systematic review of existing safety protocols. This aligns with the principles of continuous quality improvement and proactive risk management, which are implicitly and explicitly supported by regulatory frameworks governing healthcare professionals. By involving relevant personnel and referencing established guidelines, this approach ensures that any proposed changes are evidence-based, practical, and legally sound, thereby upholding the highest standards of patient care and safety, as mandated by the Limited Licensed Radiology Technologist (CLLRT) regulations. An incorrect approach that focuses solely on immediate, unverified adjustments to equipment without a thorough review of protocols fails to address the root cause of the potential safety issue. This could lead to unintended consequences, such as introducing new risks or failing to resolve the original problem, violating the principle of due diligence required by regulatory bodies. Another incorrect approach that dismisses the feedback without investigation demonstrates a lack of professional responsibility and a failure to adhere to the spirit of patient-centered care, which is a cornerstone of ethical practice and regulatory compliance. Ignoring feedback can lead to a decline in safety standards and potential breaches of professional conduct. A third incorrect approach that relies on anecdotal evidence or personal opinion rather than established safety guidelines or regulatory requirements is inherently risky. It bypasses the structured, evidence-based decision-making process expected of licensed professionals, potentially leading to non-compliant practices and compromised patient safety, which would be a direct violation of the CLLRT professional obligations. The professional decision-making process for similar situations should involve acknowledging and valuing stakeholder feedback, conducting a thorough root cause analysis of any identified issues, consulting relevant regulatory guidelines and best practices, developing evidence-based solutions, implementing and monitoring changes, and documenting all steps taken. This systematic approach ensures that decisions are informed, justifiable, and ultimately prioritize patient well-being and regulatory adherence. Question 7. The risk matrix shows that a limited licensed radiology technologist, CLLRT, is performing a chest X-ray on a patient with suspected cardiac issues. The CLLRT observes what appears to be an enlarged cardiac silhouette and some unusual vascular markings in the mediastinum. Based on the CLLRT regulatory framework, what is the most appropriate course of action for the CLLRT regarding these observations? Option A. Provide a detailed interpretation of the cardiac enlargement, suggesting potential causes like valvular disease or cardiomyopathy, and note the specific nature of the unusual vascular markings. Option B. Assume the findings are within normal variation for the patient and proceed with the examination without further comment, as detailed cardiac interpretation is outside the CLLRT scope. Option C. Attempt to adjust imaging parameters to better visualize the coronary arteries, believing that a clearer view will allow for a more definitive assessment of the vascular markings. Option D. Document the observed findings of an enlarged cardiac silhouette and unusual vascular markings in the technologist's report and forward the images and report to the supervising radiologist for interpretation. The correct answer is D. Document the observed findings of an enlarged cardiac silhouette and unusual vascular markings in the technologist's report and forward the images and report to the supervising radiologist for interpretation. Explanation. Scenario analysis. This scenario presents a professional challenge because the limited licensed radiology technologist, CLLRT, is tasked with interpreting an imaging study that involves the cardiovascular system, a complex anatomical region. The CLLRT scope of practice, as defined by the CLLRT regulations, is limited. Misinterpreting anatomical structures within the cardiovascular system could lead to incorrect reporting, potentially impacting patient diagnosis and treatment. The challenge lies in recognizing the boundaries of their expertise and knowing when to escalate or seek further clarification, adhering strictly to the defined scope of practice. Correct approach analysis. The correct approach involves recognizing that the CLLRT role is to acquire diagnostic images according to established protocols and to identify gross anatomical abnormalities that fall within their training and licensure. When faced with subtle or complex cardiovascular anatomy that requires detailed interpretation beyond their defined scope, the CLLRT must defer to a qualified radiologist or physician. This aligns with the CLLRT regulations, which emphasize performing procedures and identifying findings within the technologist's competency and licensure, ensuring patient safety and accurate diagnostic pathways. This approach upholds the principle of practicing within one's scope, a cornerstone of professional responsibility and regulatory compliance. Incorrect approach is analysis. One incorrect approach would be to attempt a detailed interpretation of complex cardiac valve function or coronary artery stenosis. This exceeds the CLLRT scope of practice as defined by CLLRT regulations. The CLLRT is trained in anatomical identification and image acquisition, not in the detailed physiological or pathological interpretation of intricate cardiovascular structures. Attempting such an interpretation constitutes practicing beyond the scope of licensure, which is a direct regulatory failure and an ethical breach, potentially leading to misdiagnosis and patient harm. Another incorrect approach would be to ignore a clearly visible, significant abnormality within the cardiovascular structures, such as a large pericardial effusion or a gross cardiac mass, due to uncertainty about its precise nature. While detailed interpretation is beyond scope, gross, readily apparent abnormalities that are clearly outside normal anatomical presentation should be documented and reported to the supervising radiologist or physician. Failing to report such findings is a failure to adhere to the CLLRT responsibility to identify and report significant findings within their observational capacity, potentially delaying critical patient care and violating professional duty. Professional reasoning. Professionals in this role should employ a decision-making framework that prioritizes patient safety and regulatory compliance. This framework involves 1. Understanding the defined scope of practice for a limited licensed radiology technologist under CLLRT regulations. 2. Accurately acquiring images according to established protocols. 3. Identifying and documenting gross anatomical findings that are clearly outside normal presentation and within the technologist's observational capabilities. 4. Recognizing the limitations of their diagnostic interpretation skills and knowing when to escalate findings to a qualified radiologist or physician for definitive interpretation. 5. Maintaining clear communication channels with supervising physicians and radiologists. This systematic approach ensures that the CLLRT functions effectively within their authorized capacity, contributing to the diagnostic process without overstepping their professional boundaries. Question 8. The monitoring system demonstrates a consistent, albeit small, elevation in ambient radiation levels within the fluoroscopy room above the established baseline, even when no procedures are actively being performed. Considering the fundamental interactions of radiation with matter, what is the most appropriate immediate action for the limited licensed radiology technologist? Option A. Ignore the readings, as they are below the established safety thresholds for patient exposure during active procedures. Option B. Attempt to adjust the X-ray beam collimation setting to see if the radiation levels decrease, hypothesizing that increased scatter is the cause. Option C. Continue with scheduled fluoroscopic procedures, assuming the readings are due to minor environmental interference or a temporary sensor fluctuation. Option D. Immediately cease all fluoroscopic procedures, verify the calibration status of the monitoring equipment, and report the anomaly to the appropriate supervisor or radiation safety officer for further investigation. The correct answer is D. Immediately cease all fluoroscopic procedures, verify the calibration status of the monitoring equipment, and report the anomaly to the appropriate supervisor or radiation safety officer for further investigation. Explanation. The monitoring system demonstrates a slight but persistent increase in ambient radiation levels within the fluoroscopy suite, exceeding typical background readings. This scenario is professionally challenging because it requires the limited licensed radiology technologist, CLLRT, to interpret subtle changes in radiation monitoring data and take appropriate action without direct supervision, ensuring patient and staff safety while maintaining diagnostic image quality. The CLLRT must understand the fundamental principles of radiation interaction with matter to assess the potential cause and significance of the anomaly. The correct approach involves recognizing that the increased radiation levels, even if minor, indicate a potential deviation from normal operating conditions. This necessitates a systematic investigation to identify the source. Understanding that radiation interacts with matter through processes like photoelectric effect, Compton scattering, and pair production helps in hypothesizing potential causes. For instance, Compton scattering, which is dominant at diagnostic energy levels, can lead to scattered radiation that contributes to ambient dose. An increase could suggest inefficient beam collimation, increased patient scatter due to higher attenuation materials, or a malfunction in the X-ray tube housing or collimator assembly. Therefore, the best professional practice is to immediately cease fluoroscopic procedures, verify the monitoring equipment's calibration, and report the anomaly to a supervisor or qualified medical physicist for further investigation and resolution. This aligns with the ethical imperative to minimize radiation exposure, ALARA principle, and regulatory requirements for radiation safety and equipment integrity. An incorrect approach would be to dismiss the readings as insignificant or a temporary fluctuation without further investigation. This fails to uphold the ALARA principle, as it allows for potentially unnecessary radiation exposure to patients and staff. It also violates regulatory requirements that mandate reporting and addressing any deviations from expected radiation levels, which are in place to ensure equipment safety and efficacy. Another incorrect approach would be to attempt to recalibrate the monitoring system without proper training or authorization, potentially leading to inaccurate readings and a false sense of security, or even further equipment damage. This bypasses established safety protocols and regulatory oversight for equipment maintenance and calibration. Attempting to continue procedures while observing the anomaly, hoping it resolves on its own, is also professionally unacceptable, as it prioritizes workflow over safety and disregards the potential for equipment malfunction or increased radiation output. The professional reasoning process for similar situations should involve a tiered approach. 1. Observe and document. Note the specific readings and any associated environmental factors. 2. Assess significance. Based on knowledge of radiation physics and established safety limits, determine if the anomaly warrants immediate action. 3. Follow protocol. Adhere to institutional policies for reporting and investigating radiation safety concerns. 4. Seek expertise. Involve supervisors or qualified personnel when the cause or resolution is unclear. 5. Ensure safety. Prioritize the reduction of radiation exposure for all individuals involved. Question 9. Governance review demonstrates that a critical diagnostic imaging unit has not undergone its scheduled quarterly quality assurance (QA) testing due to a backlog with the authorized service provider. A patient presents with an urgent need for a scan using this specific unit. The limited licensed radiology technologist, CLLRT, is aware of the missed QA. Which of the following actions best upholds regulatory standards and guidelines from the NRC and FDA regarding patient safety and equipment integrity? Option A. Contact the equipment manufacturer directly to request an expedited remote diagnostic and potential fix, bypassing the facility service provider. Option B. Operate the equipment for the urgent patient scan, documenting the missed QA in the patient's record for follow-up. Option C. Refuse to operate the equipment until the scheduled QA testing is completed by an authorized technician, and explore alternative imaging modalities or facilities if available. Option D. Proceed with the scan, assuming the equipment is functioning adequately based on its last successful QA, and inform the patient of the situation. The correct answer is B. Operate the equipment for the urgent patient scan, documenting the missed QA in the patient's record for follow-up. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the limited licensed radiology technologist, CLLRT, to balance immediate patient care needs with strict adherence to regulatory requirements for radiation safety and equipment maintenance. The CLLRT must make a judgment call on whether to proceed with a procedure that, while potentially beneficial to the patient, involves equipment that has not undergone its scheduled quality assurance (QA) testing, thereby potentially violating FDA regulations. The challenge lies in assessing the risk to the patient and the public from potential equipment malfunction versus the risk of delaying necessary medical imaging. Correct approach analysis. The correct approach prioritizes patient safety and regulatory compliance by ensuring all equipment is functioning within established parameters before use. This aligns with FDA regulations that mandate quality assurance testing for medical devices, including diagnostic imaging equipment, to ensure their safety and effectiveness. By refusing to operate the equipment until QA is completed, the CLLRT upholds the principle of do no harm and adheres to the regulatory framework designed to prevent potential harm from malfunctioning equipment. This proactive stance prevents potential misdiagnosis or unnecessary radiation exposure due to equipment failure. Incorrect approaches analysis. Operating the equipment without the scheduled QA testing, despite the patient's urgent need, represents a direct violation of FDA regulations concerning medical device performance and safety. This approach prioritizes expediency over established safety protocols, potentially exposing the patient to inaccurate imaging results or increased radiation dose if the equipment is not functioning correctly. It also creates liability for the facility and the technologist. Contacting the manufacturer for an immediate remote fix without involving the facility's authorized service personnel or QA department bypasses established protocols for equipment maintenance and validation. While the intent might be to expedite the process, it undermines the integrity of the QA program and could lead to improper repairs or calibrations, potentially violating FDA guidelines for device maintenance and service. Proceeding with the scan and documenting the lack of QA as a note for future review is a significant regulatory and ethical failure. This approach knowingly operates equipment that has not met safety and performance standards, putting the patient at risk. It also constitutes a failure to report or address a known deviation from regulatory requirements in a timely and appropriate manner, which is a critical aspect of compliance. Professional reasoning. Professionals in this situation should utilize a decision-making framework that emphasizes risk assessment and regulatory adherence. First, identify the immediate need and the potential consequences of delay. Second, consult the relevant regulatory guidelines, FDA for equipment safety and QA and internal facility policies. Third, assess the risks associated with operating non-compliant equipment versus the risks of delaying the procedure. In this case, the FDA's emphasis on equipment integrity and QA for patient safety outweighs the immediate need for the scan when the equipment's performance is unverified. The professional decision is to halt operations until the equipment is validated by authorized personnel, ensuring both patient safety and regulatory compliance. Question 10. System analysis indicates that when performing a radiographic examination, an CLLRT must optimize technical factors to achieve diagnostic image quality while adhering to radiation safety principles. Considering the interplay of kilovoltage, kVp, and milliampere seconds m as on radiation dose and image characteristics, which of the following approaches best reflects a process optimization strategy for radiation physics and safety? Option A. Maximize milliampere seconds m as to ensure a dense and high contrast image, regardless of the kilovoltage, kVp setting, to guarantee image quality. Option B. Utilize the highest possible kilovoltage, kVp, for all examinations to ensure maximum penetration, even if it results in a flat image that requires significant post-processing. Option C. Select the lowest possible kilovoltage, kVp, that provides sufficient penetration for the anatomical region, and then adjust milliampere seconds m as to achieve optimal image receptor exposure, ensuring the lowest practical dose. Option D. Prioritize achieving a technically perfect image through extensive post-processing adjustments, even if the initial exposure technique was suboptimal in terms of radiation dose. The correct answer is C. Select the lowest possible kilovoltage, kVp, that provides sufficient penetration for the anatomical region, and then adjust milliampere seconds m as to achieve optimal image receptor exposure, ensuring the lowest practical dose. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the limited licensed radiology technologist, CLLRT, to balance the need for diagnostic image quality with the imperative of minimizing radiation exposure to the patient and themselves. The CLLRT must understand the fundamental principles of radiation physics to make informed decisions about technique selection, directly impacting patient safety and the effectiveness of the examination. This requires not just technical proficiency, but also a strong ethical commitment to ALARA, as low as reasonably achievable. Correct approach analysis. The correct approach involves selecting technical factors that achieve adequate image penetration and detail, while using the lowest possible radiation dose. This aligns directly with the core principles of radiation safety mandated by regulatory frameworks governing radiologic technologists. Specifically, it reflects the understanding that higher kilovoltage, kVp, generally leads to better penetration and can allow for a lower milliampere second, m, as setting, thereby reducing the overall radiation dose. This approach prioritizes patient well-being and adheres to the professional responsibility to practice radiation safety, a cornerstone of the CLLRT scope of practice. Incorrect approach is analysis, an approach that prioritizes image density solely through high m, as without considering kVp for penetration, is incorrect. This would lead to unnecessary radiation exposure to the patient and potentially the technologist, violating the ALARA principle. It demonstrates a lack of understanding of how kVp affects beam quality and penetration, a fundamental concept in radiation physics. An approach that excessively increases kVp beyond what is necessary for adequate penetration, without compensating with m as, can lead to a washed-out image with poor contrast and detail. While it might reduce dose, it compromises diagnostic efficacy, which is also a failure of professional responsibility. The goal is not just low dose, but diagnostically useful images at low dose, an approach that relies on post-processing techniques to fix underexposed images resulting from insufficient kVp or m, as is also incorrect. While post-processing is a valuable tool, it cannot fully compensate for fundamental errors in initial exposure technique and can introduce artifacts or degrade image quality. Furthermore, it implies a failure to optimize the initial exposure, which is the primary responsibility of the technologist. Professional reasoning. Professionals should approach technique selection by first considering the anatomical region and patient size to determine the appropriate KVP for adequate penetration. Then, they should select the M as to achieve the desired image receptor exposure, density, and contrast, always aiming for the lowest possible M, as that yields a diagnostically acceptable image. This iterative process, guided by an understanding of radiation physics and a commitment to CLLRT, ensures both patient safety and diagnostic accuracy. Continuous professional development and adherence to established protocols are crucial for maintaining this competency. Question 11. Cost-benefit analysis shows that while diagnostic imaging is essential for patient care, the potential for long-term biological effects from ionizing radiation necessitates careful consideration by a limited licensed radiology technologist, CLLRT. When faced with a situation where a patient requires an X-ray, what is the most appropriate approach for an CLLRT to take regarding radiation dose and biological effects? Option A. Use the lowest possible radiation dose for all examinations, regardless of the diagnostic information that can be obtained, to completely eliminate any risk. Option B. Assume that the benefits of imaging outweigh any potential radiation risks, and therefore, dose optimization is a secondary concern. Option C. Prioritize obtaining the clearest possible image, even if it means using higher radiation doses than necessary. To avoid repeat exposures, Option D. Select imaging parameters that minimize radiation exposure while still achieving diagnostic image quality, utilizing appropriate shielding and collimation. The correct answer is D. Select imaging parameters that minimize radiation exposure while still achieving diagnostic image quality, utilizing appropriate shielding and collimation. Explanation. This scenario is professionally challenging because it requires a limited licensed radiology technologist, CLLRT, to balance the immediate need for diagnostic imaging with the long-term biological risks associated with ionizing radiation, all within the strict confines of the CLLRT regulatory framework. The LLRT must understand that while diagnostic imaging is crucial for patient care, the principles of radiation protection, particularly CLLRT, as low as reasonably achievable, are paramount and legally mandated. The challenge lies in applying these principles effectively in a real-time clinical setting where patient condition and diagnostic necessity are primary drivers, but without compromising safety. The correct approach represents best professional practice because it prioritizes patient safety and adheres to the core tenets of radiation protection as defined by the CLLRT regulations. This involves a proactive and informed decision-making process that considers the biological effects of radiation and seeks to minimize exposure without jeopardizing diagnostic efficacy. It demonstrates an understanding of the stochastic and deterministic effects of radiation and the technologist's responsibility to mitigate these risks through appropriate technique selection, shielding, and justification of the examination. This aligns with the ethical obligation to do no harm and the legal requirement to practice within the scope of licensure and regulatory guidelines. An incorrect approach that focuses solely on obtaining the image as quickly as possible without considering radiation dose fails to uphold the CLLRT principle, a cornerstone of radiation safety regulations for CLLRT. This could lead to unnecessary patient exposure, increasing the risk of stochastic effects, like cancer, and potentially deterministic effects if doses are sufficiently high. Another incorrect approach that involves using excessive radiation to ensure a perfect image directly contravenes the CLLRT principle and demonstrates a misunderstanding of the relationship between dose and image quality, as well as the potential for biological harm. A third incorrect approach that dismisses the importance of radiation dose because the patient is elderly or has a short life expectancy is ethically and regulatorily unsound. While age can influence risk, the principle of minimizing dose applies to all patients, and such a judgment falls outside the scope of an LLRT responsibilities, potentially leading to discriminatory practices and a failure to protect vulnerable individuals. Professional decision-making in such situations requires a systematic approach. First, critically evaluate the necessity of the examination and ensure it is properly justified. Second, select the lowest effective radiation dose and appropriate imaging parameters that will yield the diagnostic information required. Third, employ all available protective measures, such as collimation and shielding, to minimize the irradiated volume and protect sensitive tissues. Finally, document the procedure and any deviations from standard protocols, demonstrating adherence to regulatory requirements and best practices. Question 12. Process analysis reveals that a limited licensed radiology technologist, CLLRT, is reviewing the principles of radiation used in diagnostic imaging. The CLLRT understands that the radiation in question is generated externally by the interaction of accelerated electrons with a target material, is electromagnetic in nature, and possesses sufficient energy to penetrate human tissues and create an image. Based on these characteristics, which type of radiation is being described? Option A, X-rays. Option B, gamma rays. Option C, alpha particles. Option D, beta particles. Correct answer is A, X-rays. Explanation. Scenario analysis. This scenario presents a professional challenge for a limited licensed radiology technologist, CLLRT, by requiring them to differentiate between various types of radiation based on their interaction with matter and their potential biological effects, without direct measurement tools. The challenge lies in applying theoretical knowledge of radiation physics to a practical, albeit hypothetical, diagnostic imaging context, emphasizing the CLLRT responsibility to understand the fundamental properties of the radiation they utilize and to ensure patient safety. Accurate identification is crucial for understanding shielding requirements, potential scatter, and the nature of the image produced, all of which fall under the CLLRT scope of practice and regulatory oversight. Correct approach analysis. The correct approach involves identifying the radiation type based on its fundamental characteristics as described in the scenario. X-rays are produced by the deceleration of electrons in a target material within an X-ray tube. They are electromagnetic radiation, meaning they have no mass and travel at the speed of light. They are highly penetrating and can cause ionization. This aligns with the description of radiation used in diagnostic imaging that is generated externally and interacts with the patient's tissues to create an image. This understanding is directly supported by the regulatory framework governing CLLRT, which mandates knowledge of radiation physics and safety principles to ensure appropriate use of diagnostic imaging equipment and to minimize patient exposure. Incorrect approaches analysis. One incorrect approach would be to confuse X-rays with alpha particles. Alpha particles are helium nuclei, consisting of 2 protons and 2 neutrons. They have a significant mass and a positive charge, making them highly ionizing but with very limited penetrating power. They can be stopped by a sheet of paper or the outer layer of skin. Mistaking X-rays for alpha particles would lead to a complete misunderstanding of their behavior, shielding needs, and biological hazard in a diagnostic setting. This would be a direct violation of the CLLRT responsibility to understand the properties of the radiation they are working with, as outlined in the licensing regulations. Another incorrect approach would be to identify the radiation as beta particles. Beta particles are high-energy electrons or positrons. They are less ionizing than alpha particles but more penetrating, capable of passing through paper, but stopped by a few millimeters of aluminum. While they are charged particles, their origin and interaction characteristics differ significantly from X-rays, which are electromagnetic. Misidentifying X-rays as beta particles would lead to incorrect assumptions about shielding and scatter, potentially compromising patient and staff safety and deviating from established protocols for X-ray procedures. A further incorrect approach would be to equate X-rays with gamma rays. Gamma rays are also electromagnetic radiation, similar to X-rays, but they originate from the nucleus of an atom during radioactive decay. While both are highly penetrating, the source and typical energy ranges can differ. In the context of diagnostic radiology, the primary source of radiation is the X-ray tube, not radioactive isotopes emitting gamma rays. Fusing these would indicate a fundamental misunderstanding of the equipment and the radiation being produced, which is a critical failure in professional practice and regulatory compliance for an CLLRT. Professional reasoning. Professionals in this role should approach such questions by first recalling the fundamental definition and origin of each radiation type. They should then consider the context provided in the scenario diagnostic imaging. This context strongly points towards X-rays as the radiation of interest. The decision-making process involves systematically eliminating options that do not fit the established characteristics of X-ray production and interaction within a diagnostic imaging environment, referencing their foundational knowledge of physics and the specific regulations governing their practice. Question 13. Assessment of a chest radiograph reveals a well-defined, rounded opacity in the upper lobe of the right lung. Considering common pathologies visible on radiographs, which of the following approaches best reflects the professional responsibilities of a limited licensed radiology technologist, CLLRT, in this scenario? Option A. Diagnosing the opacity as a primary lung malignancy and recommending immediate biopsy. Option B. Identifying the opacity as a likely granuloma and noting its size and location for radiologist review. Option C. Assuming the opacity is benign due to its well-defined nature and proceeding without further documentation. Option D. Describing the opacity as a shadow and leaving further interpretation to the referring physician without any specific descriptive details. Correct answer is B. Identifying the opacity as a likely granuloma and noting its size and location for radiologist review. Explanation. This scenario presents a common challenge for limited licensed radiology technologists, CLLRT, where differentiating between similar-looking pathologies on a radiograph requires a nuanced understanding of radiographic appearances and their clinical implications. The challenge lies in accurately identifying subtle radiographic findings that could represent distinct disease processes, each with different management pathways. Careful judgment is required to avoid misinterpretation, which could lead to delayed or inappropriate patient care. The correct approach represents best professional practice because it prioritizes accurate radiographic interpretation based on established knowledge of common pathologies visible on radiographs, aligning with the CLLRT scope of practice as defined by the relevant regulatory framework. This involves recognizing characteristic patterns, densities, and locations of abnormalities. The CLLRT role is to produce diagnostic quality images and identify findings that warrant further review by a qualified radiologist or physician. This approach ensures that the technologist contributes effectively to the diagnostic process without overstepping their licensure limitations, adhering to the principle of providing competent and ethical patient care as mandated by the CLLRT guidelines. An incorrect approach that focuses solely on the most obvious or common finding without considering differential diagnoses is professionally unacceptable. This could lead to overlooking less common but significant pathologies, potentially resulting in a misdiagnosis. This failure violates the ethical obligation to exercise due diligence and the regulatory requirement to maintain a high standard of practice. Another incorrect approach that involves making a definitive diagnosis or recommending specific treatment based on radiographic findings is a significant regulatory and ethical failure. CLLRT are licensed to operate imaging equipment and identify abnormalities, not to interpret images in a diagnostic capacity or prescribe medical interventions. This overstep constitutes practicing beyond the scope of licensure, which is a serious violation of the CLLRT regulations and could have severe consequences for patient safety and professional standing. The professional decision-making process for similar situations should involve a systematic review of the radiograph, comparing observed findings against known radiographic presentations of common pathologies. The CLLRT should consider the patient's clinical history and symptoms if available, as this context can aid in prioritizing potential diagnoses. If there is any uncertainty, or if findings are outside the typical presentation of common pathologies, the CLLRT should document their observations clearly and refer the images for interpretation by a licensed radiologist or physician, adhering to established protocols for image review and reporting. This process ensures that patient care is guided by appropriate expertise and within the defined scope of practice for the CLLRT. Question 14. Comparative studies suggest that while limited licensed radiology technologists, CLLRT, are trained to identify radiographic abnormalities, their role in the assessment of neoplastic diseases is primarily focused on image acquisition and technical quality. Considering the regulatory framework for a limited licensed radiology technologist, CLLRT, which of the following represents the most appropriate and professionally responsible approach when a technologist observes radiographic characteristics that are highly suggestive of a neoplastic process in a patient's imaging study? Option A. Attempt to identify the specific type of neoplastic disease based on the observed radiographic patterns and provide a preliminary diagnostic impression to the referring physician. Option B. Document all observed radiographic findings meticulously, noting any deviations from normal anatomy that may be indicative of neoplastic changes, and ensure the images are of optimal diagnostic quality for radiologist interpretation, without offering a diagnosis. Option C. Communicate directly with the patient about the suspected neoplastic findings and advise them on the next steps for further investigation. Option D. Disregard any subtle or ambiguous radiographic findings that appear potentially neoplastic, assuming they are likely benign and not within the technologist's purview to report. The correct answer is B. Document all observed radiographic findings meticulously, noting any deviations from normal anatomy that may be indicative of neoplastic changes, and ensure the images are of optimal diagnostic quality for radiologist interpretation, without offering a diagnosis. Explanation. Scenario analysis. This scenario presents a professional challenge for a limited licensed radiology technologist, CLLRT, by requiring them to interpret radiographic characteristics of neoplastic diseases without exceeding their scope of practice. The CLLRT must recognize subtle radiographic findings that are suggestive of neoplastic processes while understanding their limitations in definitively diagnosing or staging cancer. This requires a keen eye for detail, knowledge of common radiographic appearances of various neoplasms, and a commitment to adhering strictly to their license responsibilities, which typically involve image acquisition and ensuring technical quality, not primary interpretation or diagnosis. The challenge lies in balancing the need to identify potentially significant findings with the imperative to avoid overstepping professional boundaries and providing diagnostic opinions reserved for radiologists or physicians. Correct approach analysis. The correct approach involves meticulously documenting all observed radiographic findings, noting any abnormalities that deviate from normal anatomy, and ensuring the images are of optimal diagnostic quality for review by a qualified radiologist. This aligns with the CLLRT regulatory mandate to produce high-quality diagnostic images and to report any technical deficiencies or significant incidental findings that might warrant further medical attention. By focusing on accurate image acquisition and clear documentation of observations without offering diagnostic conclusions, the CLLRT upholds their professional responsibilities and adheres to the CLLRT framework, which emphasizes technical proficiency and collaborative patient care. This approach ensures that the patient receives timely and accurate interpretation by the appropriate medical professional. Incorrect approaches analysis. One incorrect approach involves attempting to definitively identify a specific type of neoplastic disease based on radiographic characteristics. This is a direct violation of the CLLRT scope of practice, as diagnostic interpretation and the identification of specific pathologies are the exclusive domain of licensed radiologists and physicians. Such an action constitutes a regulatory failure by exceeding license capabilities and an ethical failure by potentially providing inaccurate or misleading information to the patient or referring physician, thereby compromising patient safety and trust. Another incorrect approach is to disregard or minimize any observed radiographic abnormalities that appear potentially neoplastic, assuming they are benign or insignificant. This represents a failure in professional diligence and a potential breach of ethical responsibility to the patient. While CLLRT are not diagnosticians, they are expected to recognize deviations from normal that could be clinically relevant. Failing to document or report such findings, even if they are not definitively diagnosed, could delay crucial medical intervention, leading to adverse patient outcomes. This also undermines the collaborative nature of healthcare, where all team members have a role in patient well-being. A third incorrect approach is to communicate preliminary diagnostic impressions directly to the patient or referring physician without the explicit authorization or oversight of a radiologist. This bypasses the established chain of communication and professional hierarchy within medical imaging. It is a regulatory failure as it involves practicing outside the defined scope of an CLLRT, and an ethical failure due to the potential for miscommunication, anxiety, and inappropriate patient management based on incomplete or unconfirmed information. Professional reasoning. Professionals in this role should adopt a systematic approach. First, Ensure the technical quality of the radiographic images is paramount. Second, meticulously observe and document all anatomical structures and any deviations from normal, using objective descriptive language. Third, identify findings that are outside the scope of their diagnostic ability, but are clearly abnormal and potentially significant, such as masses, calcifications within lesions, or bone destruction. Fourth, report these observations clearly and concisely in the appropriate system for radiologist review, without offering any diagnostic conclusions. Finally, always operate within the defined scope of practice, as outlined by the CLLRT regulations, understanding that collaboration and clear communication with radiologists and physicians are essential for optimal patient care. Question 15. The efficiency study reveals that the mammography unit's anode angle is consistently set at a wider degree than recommended for routine screening mammography, potentially impacting image resolution and beam uniformity. Which of the following actions best addresses this finding to ensure optimal patient care and regulatory compliance? Option A. Continue using the current anode angle settings, assuming they are acceptable as long as diagnostic images are being produced. Option B. Adjust the anode angle manually based on personal experience without consulting technical documentation or a service engineer. Option C. Initiate a recalibration of the anode angle to the manufacturer's specified settings or established clinical standards for screening mammography. Option D. Increase the KVP to compensate for any perceived decrease in image quality due to the wider anode angle. The correct answer is C. Initiate a recalibration of the anode angle to the manufacturer's specified settings or established clinical standards for screening mammography. Explanation. The efficiency study reveals that the mammography unit's anode angle is consistently set at a wider degree than recommended for routine screening mammography. This scenario is professionally challenging because it directly impacts image quality and patient safety, requiring the technologist to understand the underlying physics of X-ray production and its relationship to equipment settings. A wider anode angle, while increasing the focal spot size, can lead to decreased spatial resolution, potentially obscuring subtle microcalcifications or masses, which are critical for early breast cancer detection. Furthermore, it can affect the uniformity of the X-ray beam intensity across the detector, leading to suboptimal dose distribution. The correct approach involves recalibrating the anode angle to the manufacturer's specifications or the established clinical standard for screening mammography. This represents best professional practice because it adheres to the fundamental principles of diagnostic imaging, ensuring optimal image quality for accurate diagnosis and minimizing patient radiation dose by using the most efficient beam geometry. This aligns with the regulatory framework's emphasis on providing high-quality diagnostic images and maintaining patient safety through appropriate equipment utilization and quality control. An incorrect approach would be to ignore the finding, assuming the current settings are adequate because diagnostic images are still being produced. This is professionally unacceptable, as it violates the principle of continuous quality improvement mandated by regulatory bodies, fails to proactively address a known deviation that compromises diagnostic efficacy, and potentially exposes patients to unnecessary radiation or suboptimal image interpretation. Another incorrect approach would be to adjust the anode angle without consulting the equipment manual or a qualified service engineer. This is a regulatory and ethical failure because it bypasses established protocols for equipment maintenance and calibration, potentially leading to further equipment malfunction or incorrect settings that could compromise patient care and safety. It also demonstrates a lack of understanding of the critical role of precise equipment calibration in maintaining diagnostic standards. Professionals should approach such situations by first understanding the implications of the observed deviation. This involves recalling or researching the physics of X-ray production, specifically the Heel effect and focal spot characteristics related to anode angle. The next step is to consult the equipment's technical manual and relevant clinical guidelines or regulatory standards for recommended settings. If a deviation is identified, the professional should initiate the appropriate quality control procedures, which may involve contacting the service engineer for recalibration. This systematic approach ensures that patient care is prioritized, regulatory compliance is maintained, and the diagnostic integrity of the imaging process is upheld. Question 16. to address the challenge of minimizing patient radiation exposure while ensuring diagnostic image quality for a routine chest X-ray. Which of the following represents the most appropriate risk assessment and mitigation approach for a limited licensed radiology technologist? Option A. Adjusting imaging parameters based on the patient's age and body habitus, utilizing appropriate collimation, and reviewing the clinical indication to ensure the most efficient protocol is used. Option B. Proceeding with the standard imaging protocol without any modifications, assuming it is optimized for all patients. Option C. Increasing the radiation dose to ensure the clearest possible image, regardless of the patient's characteristics. Option D. Relying solely on the radiologist's interpretation to identify any potential issues related to radiation dose after the image has been acquired. The correct answer is A. Adjusting imaging parameters based on the patient's age and body habitus, utilizing appropriate collimation, and reviewing the clinical indication to ensure the most efficient protocol is used. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a limited licensed radiology technologist, CLLRT, to balance the need for diagnostic imaging with the imperative to minimize patient radiation exposure, a core principle of radiation safety. The challenge lies in identifying and implementing appropriate risk mitigation strategies without compromising the diagnostic quality of the images, which directly impacts patient care and diagnosis. The CLLRT must exercise sound professional judgment, informed by regulatory requirements and ethical considerations, to make decisions that protect the patient. Correct approach analysis. The correct approach involves a systematic and proactive assessment of potential risks associated with the imaging procedure and the implementation of specific, evidence-based strategies to mitigate those risks. This aligns directly with the principles of ALARA, as low as reasonably achievable, and the regulatory framework governing radiologic practice, which mandates patient protection from unnecessary radiation. By considering factors such as patient history, the specific examination requested, and available technology, the CLLRT can tailor the imaging protocol to reduce dose while ensuring diagnostic efficacy. This proactive stance is the cornerstone of responsible radiologic practice and is implicitly or explicitly required by regulations that emphasize patient safety and quality of care. Incorrect approach is analysis. One incorrect approach involves relying solely on the default imaging parameters without any individualized assessment. This fails to acknowledge that patient anatomy, pathology, and positioning can significantly influence radiation dose and image quality. It represents a failure to apply the ALARA principle and a potential violation of the CLLRT duty to optimize radiation exposure for each patient. Another incorrect approach is to prioritize image acquisition speed over dose reduction, potentially leading to higher radiation doses than necessary for diagnostic purposes. This disregards the fundamental ethical and regulatory obligation to minimize patient exposure. Finally, ignoring patient history or clinical indication when selecting imaging parameters demonstrates a lack of critical thinking and a failure to integrate essential information for risk assessment, potentially leading to inappropriate imaging or unnecessary radiation. Professional reasoning. Professionals in this field should adopt a decision-making process that begins with a thorough understanding of the clinical indication for the examination. This is followed by an assessment of patient-specific factors that may influence radiation dose and image quality. The CLLRT should then consult relevant imaging protocols and guidelines, critically evaluating them in the context of the individual patient. The selection of appropriate technical parameters, e.g., KVPM as filtration collimation, should be guided by the principle of ALARA, aiming to achieve diagnostic image quality with the lowest possible radiation dose. Continuous professional development and staying abreast of advancements in radiation safety techniques are also crucial. Question 17. Process analysis reveals that a limited licensed radiology technologist, CLLRT, is presented with a patient who has sustained significant blunt force trauma to the chest and abdomen following a motor vehicle accident. The patient is hemodynamically unstable and requires immediate medical intervention. Considering the CLLRT scope of practice and the critical nature of the situation, which of the following approaches best aligns with providing timely and diagnostically relevant radiographic imaging while prioritizing patient safety? Option A. Prioritize obtaining the most critical radiographic views necessary to identify immediate life-threatening injuries, e.g., pneumothorax, hemothorax, diaphragmatic rupture, based on the clinical presentation and mechanism of injury, while minimizing patient movement. Option B. Perform only a single, general anterior-posterior (AP) view of the chest and abdomen, without further consideration of specific injury patterns or clinical findings. Option C. Delay all radiographic imaging until the patient is stabilized and no longer hemodynamically unstable to ensure optimal patient comfort and image quality. Option D. Obtain a standard, comprehensive chest and abdominal radiographic series as per routine protocol, ensuring all views are acquired regardless of the patient's condition. The correct answer is D. Obtain a standard, comprehensive chest and abdominal radiographic series as per routine protocol, ensuring all views are acquired regardless of the patient's condition. Explanation: Scenario analysis. This scenario presents a professionally challenging situation due to the critical nature of trauma imaging. The limited licensed radiology technologist, CLLRT, must balance the immediate need for diagnostic imaging with the potential for exacerbating patient injury or compromising image quality due to patient movement or suboptimal positioning. The urgency of trauma cases, coupled with the potential for life-threatening injuries, demands rapid yet precise radiographic execution. The CLLRT judgment is paramount in selecting the most appropriate imaging protocol and technique, while ensuring patient safety and diagnostic efficacy. Correct approach analysis. The correct approach, which involves prioritizing the most critical views to rule out immediate life-threatening injuries based on the patient's clinical presentation and mechanism of injury, represents best professional practice. This aligns with the principles of ALARA, as low as reasonably achievable, by minimizing radiation exposure to the patient by obtaining only necessary diagnostic images. Furthermore, it adheres to the ethical obligation to provide competent patient care, which in trauma situations means obtaining images that will guide immediate medical management. This approach is supported by the general principles of radiologic practice, which emphasize diagnostic yield and patient safety, and by the implicit understanding within the scope of practice for an CLLRT to contribute to the diagnostic process in emergent situations. While specific CLLRT regulations may not detail every trauma protocol, the overarching mandate for competent and safe practice necessitates this prioritized approach. Incorrect approaches analysis. One incorrect approach would be to perform a complete, routine radiographic series for every trauma patient, regardless of the clinical indication or mechanism of injury. This fails to acknowledge the urgency of trauma and can lead to delays in diagnosis and treatment of critical injuries. It also exposes the patient to unnecessary radiation, violating the ALARA principle. This approach demonstrates a lack of clinical judgment and an inability to adapt standard protocols to emergent situations, which is a failure of professional competence. Another incorrect approach would be to delay imaging until the patient is fully stabilized and comfortable, or until a radiologist is immediately available to dictate specific views. While patient comfort and radiologist consultation are important, in trauma, immediate imaging is often crucial for life-saving interventions. This delay can have severe consequences for the patient's outcome and represents a failure to act in the patient's best interest in a timely manner, a breach of professional duty. A third incorrect approach would be to perform only a single, general view without considering the specific injuries suspected or the mechanism of trauma. This would likely yield insufficient diagnostic information to guide treatment, potentially leading to misdiagnoses and further patient harm. It demonstrates a superficial understanding of radiographic interpretation and a failure to apply knowledge to the specific clinical context, which is a fundamental aspect of professional practice. Professional reasoning. Professionals in this situation should employ a systematic decision-making process. First, they must thoroughly assess the patient's clinical presentation, mechanism of injury, and any reported symptoms. Second, they should consult available protocols or guidelines for trauma imaging, adapting them based on the clinical assessment. Third, they must prioritize imaging based on the likelihood of life-threatening injuries, focusing on views that will provide the most critical diagnostic information for immediate medical management. Fourth, they should execute the chosen radiographic techniques with precision, ensuring patient safety and image quality. Finally, They should communicate any significant findings or challenges encountered during the imaging process to the referring physician or radiologist. This process emphasizes critical thinking, clinical judgment, and adherence to professional standards of care in a high-stakes environment. Question 18. Strategic planning requires a limited licensed radiology technologist, CLLRT, to evaluate the integration of new image receptor technology into their practice. Considering the regulatory framework for CLLRT, which approach best balances technological advancement with patient safety and diagnostic accuracy. Option A. Focus on acquiring the highest resolution image receptor technology, regardless of its compatibility with existing CLLRT protocols or the need for extensive retraining. Option B. Prioritize the adoption of the most cost-effective digital imaging system available, assuming it will improve efficiency. Option C. Implement a new digital system immediately upon vendor recommendation, relying on the vendor's assurance of superior performance. Option D. Conduct a thorough risk assessment of any new image receptor technology, evaluating its impact on image quality, radiation dose, workflow, and compliance with state regulations governing CLLRT practice before implementation. The correct answer is B. Prioritize the adoption of the most cost-effective digital imaging system available, assuming it will improve efficiency. Explanation. This scenario presents a professional challenge because it requires the limited licensed radiology technologist, CLLRT, to balance the immediate need for diagnostic imaging with the long-term implications of technology adoption and patient safety, all within the strict confines of the CLLRT regulatory framework. The CLLRT must consider not only the technical aspects of image receptor technology, but also how its implementation aligns with established standards for quality, radiation safety, and patient care, as defined by the relevant U.S. state regulations governing limited scope practice. Careful judgment is required to ensure that any decision regarding image receptor technology directly supports the CLLRT scope of practice and does not inadvertently lead to diagnostic inaccuracies or compromise patient well-being. The correct approach represents best professional practice because it prioritizes a systematic evaluation of new image receptor technology against established regulatory requirements and clinical efficacy. This involves understanding how the technology impacts image quality, radiation dose, and workflow, and ensuring it can be operated safely and effectively within the CLLRT authorized procedures. Adherence to state-specific regulations, which often mandate competency in equipment operation and quality assurance, is paramount. This proactive and informed approach ensures that patient care remains at the highest standard and that the CLLRT operates within their legal and ethical boundaries, directly fulfilling the mandate of the CLLRT certification to provide safe and effective diagnostic imaging. An incorrect approach that focuses solely on cost savings without a thorough assessment of image quality and regulatory compliance would be a significant ethical and regulatory failure. State regulations for CLLRT often implicitly or explicitly require that the technology used produces diagnostic quality images and that the technologist is competent to operate it. Implementing technology that compromises image quality could lead to misdiagnosis, requiring repeat procedures and increasing patient radiation exposure, which violates the principle of ALARA, as low as reasonably achievable, and potentially patient safety standards. Another incorrect approach, such as adopting a new digital system without adequate training or validation of its performance within the CLLRT scope, would also be a regulatory failure. CLLRT are licensed to perform specific imaging procedures, and the technology used must be appropriate for those procedures. Lack of training can lead to improper technique, suboptimal image acquisition, and potential equipment malfunction, all of which fall outside the expected standard of care and could violate licensing board requirements for continuing education and safe practice. Finally, an approach that relies on anecdotal evidence or vendor claims without independent verification of performance and safety will be professionally unsound. The CLLRT has a responsibility to ensure the technology meets established diagnostic standards and regulatory requirements. Relying on unverified information could lead to the use of substandard equipment, compromising patient care, and potentially violating professional conduct guidelines. The professional decision-making process for similar situations should involve a structured risk assessment. This begins with clearly defining the problem or opportunity, e.g., evaluating new image receptor technology. Next, identify potential risks and benefits associated with each option, considering factors like image quality, radiation dose, workflow efficiency, cost, and regulatory compliance. Then, evaluate these risks and benefits against the CLLRT scope of practice, established clinical protocols, and relevant state regulations. Finally, select the option that best mitigates risks, maximizes benefits, and ensures compliance with all legal and ethical obligations, documenting the decision-making process for future reference and accountability. Question 19. The performance metrics show a slight increase in repeat chest X-rays due to suboptimal image quality when patients present with acute respiratory distress. Considering the anatomy of the respiratory system, what is the most appropriate initial action for a limited licensed radiology technologist when a patient exhibits significant shortness of breath and shallow breathing prior to a standard chest X-ray? Option A. Focus on ensuring the X-ray equipment is functioning optimally, as this is the primary factor influencing image quality. Option B. Proceed with the standard chest X-ray protocol without modification, assuming the equipment will compensate for any subtle anatomical variations. Option C. Assess the patient's breathing pattern and depth, and consider potential anatomical implications on lung expansion and diaphragm excursion that might necessitate minor adjustments to standard positioning or technique to optimize visualization of the thoracic structures. Option D. Immediately assume the patient's condition is unrelated to thoracic anatomy and proceed with the standard protocol, prioritizing speed. The correct answer is C. Assess the patient's breathing pattern and depth, and consider potential anatomical implications on lung expansion and diaphragm excursion that might necessitate minor adjustments to standard positioning or technique to optimize visualization of the thoracic structures. Explanation. Scenario analysis. This scenario presents a professional challenge because the technologist is faced with a discrepancy between observed patient presentation and standard imaging protocols. The challenge lies in accurately identifying the anatomical structures involved in the patient's respiratory distress and determining the most appropriate imaging approach without compromising patient safety or diagnostic accuracy. This requires a strong understanding of respiratory anatomy and the potential impact of various pathologies on these structures. The technologist must exercise critical judgment to decide whether to proceed with the standard protocol, modify it, or seek immediate clarification, all while adhering to the CLLRT regulatory framework. Correct approach analysis. The correct approach involves a systematic assessment of the patient's respiratory system anatomy in the context of their presenting symptoms. This means recognizing that the primary structures involved in breathing are the lungs, diaphragm, and thoracic cage. Understanding how conditions like pneumothorax or pleural effusion would manifest anatomically, e.g., collapsed lung fluid accumulation, is crucial. The technologist must then consider how these anatomical alterations might affect the standard imaging technique and the resulting image quality. The best professional practice is to correlate the patient's clinical presentation with their respiratory anatomy and the potential impact on the imaging procedure, ensuring the acquired images will provide the necessary diagnostic information for the referring physician. This aligns with the CLLRT mandate for competent and safe practice, which implicitly requires anatomical knowledge to perform diagnostic imaging effectively. Incorrect approach is analysis. Proceeding with the standard protocol without considering the patient's specific anatomical presentation and symptoms is a regulatory and ethical failure. This approach ignores the potential for the patient's condition to alter the expected anatomy, leading to suboptimal or misleading images, demonstrates a lack of critical thinking and a failure to adapt practice to individual patient needs, which is contrary to the principles of competent radiological practice. Assuming the patient's symptoms are unrelated to the thoracic anatomy and proceeding with the standard protocol without further investigation is also a failure. This demonstrates a lack of understanding of the interconnectedness of the respiratory system and its impact on imaging. It could lead to misdiagnoses or misinterpretations of the radiographic findings. Focusing solely on the technical aspects of the imaging equipment without considering the patient's anatomical presentation is another failure. While equipment proficiency is important, it is secondary to understanding the underlying anatomy and pathology that the imaging is intended to visualize. This approach prioritizes procedure over patient care and diagnostic purpose. Professional reasoning. When faced with a patient presenting with symptoms that may affect the respiratory system, a limited licensed radiology technologist must first activate their knowledge of respiratory anatomy. This includes the lungs, pleura, diaphragm, and thoracic cage. The technologist should then correlate the patient's reported symptoms, e.g., shortness of breath, chest pain, with potential anatomical abnormalities. The next step is to consider how these potential abnormalities might influence the standard imaging protocol. This might involve adjusting patient positioning, exposure factors, or even the specific views obtained. If there is significant uncertainty or a high suspicion of a critical condition, the technologist should consult with a supervising radiologist or physician before proceeding. This systematic approach ensures that the imaging is tailored to the individual patient, maximizing diagnostic yield and patient safety, in accordance with the principles of competent and ethical practice. Question 20. Consider a scenario where a limited licensed radiology technologist, CLLRT, is reviewing a computed tomography, CT, scan of the brain. The CLLRT observes a distinct anatomical structure located at the base of the brain, posterior to the pons and medulla oblongata, which appears smaller and more convoluted than the superior portion of the brain. Based on their knowledge of nervous system anatomy, what is the most accurate identification of this structure? Option A, thalamus. Option B, corpus callosum. Option C, pituitary gland. Option D, cerebellum. Correct answer is D, cerebellum. Explanation. Scenario analysis. This scenario presents a professional challenge because the limited licensed radiology technologist, CLLRT, is tasked with interpreting subtle anatomical variations that could impact patient care and diagnosis. The CLLRT must rely on their foundational knowledge of the nervous system's anatomy to identify potential abnormalities while adhering strictly to their scope of practice as defined by CLLRT regulations. Misinterpretation or overstepping their defined role could lead to diagnostic errors, patient harm, and regulatory violations. Correct approach analysis. The correct approach involves accurately identifying the anatomical structures of the central nervous system, specifically differentiating between the cerebrum, cerebellum, and brainstem, and recognizing their typical appearances on imaging. This demonstrates adherence to the CLLRT scope of practice, which permits the technologist to perform and process diagnostic imaging procedures. By focusing on accurate anatomical identification and reporting findings within their defined capabilities, the CLLRT upholds professional standards and regulatory compliance. This approach ensures that the CLLRT provides accurate technical data for the radiologist's interpretation, which is their primary responsibility. Incorrect approach is analysis. One incorrect approach would be to attempt to diagnose a specific neurological condition based solely on the observed anatomical variations. This oversteps the CLLRT scope of practice, which is to acquire and process images, not to provide medical diagnoses. Such an action would violate CLLRT regulations by practicing outside of their licensed capabilities, potentially leading to misdiagnosis and patient harm. Another incorrect approach would be to ignore or inaccurately label the observed anatomical variations. This failure to accurately identify and document relevant anatomical findings compromises the quality of the diagnostic study. It could lead to delayed or incorrect diagnoses by the interpreting radiologist, violating the ethical duty to provide competent and thorough imaging services as expected under CLLRT guidelines. A third incorrect approach would be to communicate preliminary diagnostic impressions directly to the patient. CLLRT are not authorized to provide medical diagnoses or prognoses. This action would violate patient communication protocols and CLLRT regulations, potentially causing undue patient anxiety and interfering with the radiologist's role as the primary interpreter of diagnostic images. Professional reasoning. Professionals in this situation should employ a systematic approach. First, they must confirm their understanding of the relevant nervous system anatomy as it pertains to the imaging modality being used. Second, they should meticulously identify and label all visible anatomical structures, noting any deviations from the norm. Third, they must document these findings objectively and accurately in the imaging report, adhering to established protocols. Finally, they should transmit the completed study to the interpreting radiologist, understanding that their role is to provide high-quality imaging data for expert interpretation, not to perform the interpretation themselves. This structured decision-making process ensures compliance with regulations, ethical practice, and optimal patient care.